2 months post mid-facelift, and I'm a bit disappointed with outcome. What are my options? I'm 54, in pretty good health, but have a fair amount of sun damage, as I've been an outdoor gal for many years. I've had decent IPL results, Botox on forehead only, and now a great new neck. However, now I have very pronounced lines at corners of mouth, and smoker's lines, never have smoked. Hate to think I have to spend more money already, as I thought these would be at least a bit better. I did have some sort of laser work on those smoker lines over 5 years ago.
Thank you for your question. You're 54 years old, and it's 2 months since you've undergone what you describe as a mid-facelift. You've described a history where you've done Botox, IPL, and you've dealt with some of the lines and issues you've had in the past. And you're currently disappointed in the appearance of the outer corner of your mouth and what you describe as smoker's lines. And so in reviewing the two photos you submitted, it's clear that essentially there is a change. Just to give you a little bit of my background, I'm a board-certified cosmetic surgeon. I'm also a fellowship-trained oculofacial plastic surgeon. I specialize in facial aging, and I've written books about facial aging, and I've been in practice in Manhattan and Long Island for over 20 years. I do a lot of cosmetic eyelid surgery and all types of facelifting surgery, as well as facial implants. I also do a lot of non-surgical treatment of facial aging. So with that out of the way, looking at your photos, and just since you saw just the lower part of your face, it's clear that your neck appears to be improved from your pre-treatment photo, as well as the jawline and the area around your mouth. What I think you're probably understanding is the revealing of the volume loss that is associated with facial aging. In consultation with my patients about cosmetic surgery, particularly facelifting surgery, I always explain that when we do a facelift, we are restoring one significant element of facial aging, and that element is descent. The soft tissue of the face, the fat, the skin, and the underlying structure called the SMAS, also known as the superficial musculoaponeurotic system. This is the layer often referred to as the muscle that is lifted in whatever way is appropriate for the patient in order to provide a foundation and a support. In addition, we do things, as appears in your situation, like a platysmoplasty, which is to address the neck bands and to improve the angle of the neck and to overall put everything back to where it should be. The other side of this is that facial aging is also volume loss. Volume loss means that there's loss of bone, muscle, fat, soft tissue. There are times when I see a patient when I will recommend the placement of facial implants as part of that. For example, along the jawline, there is a little depression in the sides, referred to as the mandibular notch. Even when you lift the face aggressively, the skin will go in that area. So it's not unusual to put a chin implant or a pre-jowl implant in order to fill that area. Now there are also other options that we do later. And the same does apply for the mid-face, such as the placement of cheek implants. Now that being said, what has also been a trend for us in our practice is when doing consultation, patients can sometimes be overwhelmed by thinking of not only getting the lift, but also about the different facial implant options. So it's very important that when we do our discussions, that we describe where there will still be a need for volume enhancement. And I think there may have been some miscommunication between you and your doctor about that issue after the procedure. I always explain that the facelifting procedure restores structure, and then fillers will restore volume, and that includes Botox and injectables such as Restylane and Juvederm. In fact, a good number of my past facelift patients who've come in, we've been doing variations of what's called the Y-lift, and essentially this is a method of placement of hyaluronic acid filler such as Juvederm and Voluma at the deeper levels of the facial structure adjacent to the bone structure and below the muscle. What we found is that after the lift is done, if someone has volume loss in the cheek area or volume loss in the chin and jowl area, doing a Y-lift method to fill those areas has really been extremely effective. In addition, around the mouth, there is always a need for a combination of fillers such as Restylane, Juvederm, hyaluronic acids to outline the lips, to maybe add some lip volume, as well as the use of laser to help improve vertical lines around the mouth. We also commonly use platelet-rich plasma and to help this area as well, because we're talking about building collagen, and again we're talking about restoring volume. So I think that this is a discussion you should have with your surgeon about addressing these issues. It's understandable that you're concerned about the cost, but when it comes to maximally improving your face so that you address both the sagging and the volume loss, there is invariably some degree of maintenance needed. Now, this is all in the eye of the patient. If a lot of times our patients who want volume improvement can be satisfied with very limited placement. They don't have to have a lot of injectable. A lot of times a combination of outlining the lips and improving the cheeks and improving the chin can make a world of difference. So this is about communications with your doctor and seeing what kind of strategy is ideal after you've completed the healing period. Something to be aware of is that 2 months after surgery, there is still going to be some degree of swelling from the facelift, which means that you may even notice more volume loss as the swelling comes down. A lot of times people look extremely good within the first couple of weeks after a facelift because there's some swelling. The swelling smooths out the wrinkles and compensates for some of the volume loss. I know that's not the best news to hear, but it's important that you really understand what you're going through at this time. So I hope that was helpful. I wish you the best of luck, and thank you for your question.